That's 57.
Okay.
And then it's on YouTube in 2 weeks. Hi, how are you doing today? Welcome to our show here. And I have a guest with me today, Dr. Mahtab Ahmed, who is a specialist in being overweight, board certified, American Board of Obesity Medicine. So he knows a great deal because diabetes most of the time is due to being overweight. Although 25% of the people called TOFIs, thin on the outside, but fat on the inside, fatty liver. Mm-hmm. So I always tell people, you're not just what you eat. You may say, okay. You're not just what you digest. You are what your blood work is. Get your blood work. I recommend blood testing. I know nobody does this besides me. I don't know if how you would feel about this. I think people should have their blood work done every year starting at age 1. What do you think? Am I way out of base here? Come on, tell me, Ahmed, am I way out of base here?
No, I think there are some
kids
genetic
get
predisposition. Yeah, yeah.
A lot of obesity age 2 to age 6, I'm reading. Mm-hmm. So, yearly blood testing, I think we're in agreement. Because we're trying to teach you how to avoid the 50, are we up to 50, 70 now, illnesses that are caused from being overweight.
Yeah, 70,
yeah. 50 to 70 or so. 70, is that the
70,
answer?
Yep.
These are the illnesses that can be avoided by, exercise a half hour a day and being close to a normal weight. Just think of it. Cancers and blindness and dementia and heart attacks and strokes, some of which come unannounced, incidentally. 50% of people who die from a vascular disease, from heart attacks, they have no angina, no warning. They just grab their chest, they fall over and they're dead. Wow, that's a little scary, you know what I mean? And I'd like to tell you too, incidentally, angina, the warning of heart disease, is different in men and women. A lot of people don't know that. I don't know if you're aware of that. But women, angina can be on the right side. Yeah, right axilla, right arm. Matter of fact, I've read it, that any pain in a woman between the pubis and between her ears, right or left, can be angina.
Yes.
I saw it once as a neurosurgeon, was I used to do years ago. A lady came to see me with right arm pain, and she had abnormalities on, like 35 years old. It had evidence on MRI of some disc disease, and I thought maybe she's going to need surgery. Time she left the office, she fell on the sidewalk with a heart attack. Yeah, so it was angina.
Yeah.
And then I had a cardiologist tell me recently while I was playing pickleball, he said, yeah, he saw a patient recently whose pain was just in the axilla. So, and these are illnesses I want you to avoid. There's type 1 and type 2 diabetes. Okay, type 1, young people more likely get it, but the type 2 diabetics where the pancreas eventually dies from working too hard, they become type 1 also. And type 1 is the pancreas is dead. Okay, you can run what's called a C-peptide test that tells you the state of your pancreas. No matter where you're diagnosed, it's a good idea to get the figure because of the people that develop with type 2 diabetes where you make too much insulin, okay? So to check, when you check your blood, you might get a serum insulin that may be elevated even before your blood sugar, incidentally. So to run a glucose tolerance test with a blood sugar and a serum insulin helps diagnose it much earlier, because you and I's mission is really, isn't it, to catch people even before pre-diabetes. That's usually, what, 5 years or so, where they have insulin resistance, and not even pre-diabetes yet, where if you lost 5 pounds of weight, disease is gone.
Never gone, yep.
Yeah.
It's actually 12 years.
12 years. 12 years you could have abnormal blood work, which would include abnormal...
impaired sugar.
Triglycerides, HDL is low. And what I love to see, this is my dream, okay? And we're dreamers, you and I are dreamers, is that we put on a computer you can put it in a book if you want, but now that we're so good with data and computers, starting, say, at age 1, that we put results of the laboratory studies on the computer, and as you're approaching, say, pre-diabetes or even insulin resistance, that the computer, that part of the page becomes red or something. And when you go to see the doctor, and I'm foreseeing the future, I think the future should be that the wall is the computer page. You walk in there and this digital thing, it turns on, the doctor looks you in the eye and not in the eye of the computer, and he says, well, let's see how the fats in your blood are doing, your triglycerides, and it shows this graph changing color, and as you're approaching pre-diabetes or even before diabetes, that the corrective action could be taken right there. So we could diagnose you much earlier, 5% weight loss, we added 25 years to your life, save you from 35 years of disability. Wouldn't that be wonderful? I think it's going to happen. That way the doctor could, instead of in the computer, the whole wall is a computer page, and it's highly simplified. I find today it's too complex. I operate somebody for a half hour and I get to dictate on the computer for an hour. That's got to change. That happened to me. That's true. Yeah, that's got to change because we're not looking the patient in the eye. We got to look the patient in the eye. I notice on the overweight people that you want to treat, that it's very important to you that you become face to face. And I think you'll be good at it, Ahmed, because you have a soft voice. I had a nurse one time work for me for a while, a big black guy, big long hair, and never dressed that good. May not have been the best nurse, but when he decided to move to Indianapolis, I had 3,000 people come to office and ask me
where is he?
Where he is. 3,000. When another nurse retired 30 years, 2 people called. And the reason was he had a soft voice. Yeah, interesting. Then I read more about that, and a soft voice is pretty important. I mean, I qualify. Tell it. Now, you saw a lot of patients with diabetes. You had them lose weight. That's what you teach people. And you've had them lose their diabetes and get rid of all the medications. Tell us about a case.
There are multiple cases when the diabetes education starts teaching them what diabetes is. So I'm going to start off telling them that there is a cell called beta cell in the pancreas. Right near the stomach there is a gland, and beta cell in the pancreas makes insulin. And every time we eat sugar, insulin comes in and take care of that sugar, 2 hours, keep the blood sugar normal. Now the beta cell has limited capability to function, and there is genetic predisposition. Some people's beta cell doesn't work well. For example, Indian population, they have limited capability, okay? So there is a test called hemoglobin A1C, A1C. It tells you how much sugar last 3 months. So if it is 7, that's kind of like a diabetes. What that tells us that 50% of those cells already dead. So by the time you diagnose diabetes, 50% of the beta cell is not functioning, you're not making good insulin. Now, if you just working them hard, eating a lot of carbohydrate, what will ask those cells to work over time. And with time, within few years, you will end up with insulin. So there is a way to prevent that demise of those cells. Number one, you eat less carbohydrate. If you eat less carbohydrate, whatever amount you're making, that should be good. That should take care of it. You're not making them work over time. Second, you need to do exercise. If you do exercise, the amount of sugar will be used by the muscle, so you're lifting up that pressure on those cells to work hard. I'm going to use the term, let's baby those cells long term so they can survive and you don't need insulin shot. So third thing you can do, don't use any medicine which stimulate those beta cells. For example, there is a cheap medicine called glimepiride. You'll have too much insulin. It will stimulate those cells who are already in trouble. You are making them work harder. Within short few years, they will die. They'll burn out. So you avoid that kind of pill. Instead, you use the pill which doesn't bother those cells.
Yeah.
So you need to use metformin or some other medication which doesn't bother them cells. The last thing we know, 10% weight loss helps those cells prolong their life. So those 4 things, you start doing it. Eat less carb, you start doing exercise, take the right kind of pill, and lose weight. You can baby those a long time. You'll never need insulin.
Yeah, thank you very much. And that's the point of our talk today, is that prevention,
Mm-hmm.
you know, to catch people even the pre-diabetes,
Mm-hmm.
or even before that, 5-8% weight loss, you don't get the disease.
Mm-hmm.
And the beta cells in the pancreas, which we were speaking about, you can order what's called a C-peptide
Yes.
test, tells you the
So-
state of the pancreas,
Yes.
which is not a bad idea. And as you already mentioned, by the time they diagnose you with diabetes, say HbA1c
Yeah.
over 7 or
Yep.
6.7, whatever they use,
It's late.
that by that time, 50% of the pancreatic cells are gone.
Yeah.
But I understand from further studies that they can wake up again, some
Yes.
too. You can prevent more damage, and some can
Regenerate.
wake up.
Yes.
So to full blast to really go at it. And people who've, you know, that we see with the complications of type 2 diabetes, let's go over those a minute, and start in the brain. 75% of Alzheimer's disease or dementia, whatever you want to call it, is due to insulin resistance. Insulin has to remove the amyloid, which is a protein in the brain that's left over from metabolism in the brain. The insulin has to remove that, and when you have type 2 diabetes, it has other things to do. It can't remove the amyloid, and you start getting dementia and memory loss. So a lot of the memory loss problems could be avoided by getting to a normal weight. Insulin also does many other things, you know, which you know it stiffens the arteries, increased rates of cancer, it causes dementia, it causes arthritis, increased rates of cancer. And I can go on and on. So insulin doesn't just bring sugar into the cell. The door opener, many other things. So to keep it low from eating the right way is important. Then we go down, it causes gum disease. Diabetes causes. As a matter of fact, Queen Elizabeth was the only one who could afford to eat sugary foods. She had black teeth, understanding that teeth fall out, thyroid disease, heart attacks, strokes, many skin diseases, a lot of eye diseases. A lot of the eye diseases are due to microvascular disease. When I visit ophthalmologists, for example, and I'm getting my eyes checked or something, 80% of the people there are diabetic. They're diabetic, and they're talking about injecting their retina and one thing or another. And I've been to them before, begging them. I remember 10 years ago, I went to the best eye doctors in town and asked them if they could concentrate on teaching people how to get rid of their diabetes. It never happened.
Never happened.
And these are very high-class people. It never happened. And I was so disappointed because I was there 2 or 3 times. That's the way the world operates, you know. But I have a friend I played tennis with who lost half his vision maybe 9 months ago, and all they've been doing is injecting his eye, but he still doesn't see right. What I'm afraid of is, and I think he's pre-diabetic. You know, blood sugar was, pre-diabetes, you know, was kind of changed a little bit, I think 100 to 126, but you know, there are people talking about, Mark Hyman talking about 90, starting at 90, they're constantly changing it. And if you pay attention to the political races, there was a guy who's maybe the #1 guy now in the primary. When he had an honest doctor, I think at that time, his blood sugar was 99, he weighed 230. What do you think? What do you think? Is he pre-diabetic? Yeah, he's pre-diabetic. Yes. Let's face it. Now he weighs 240 something, and his latest doctor, you're going to live to be 200. You believe that? I don't believe that. You believe that? I don't believe that. And so let's be realistic. So I encourage you, to do something about your situation. But it's not hard. I tell people just to watch the amount of carbohydrate intake. I even saw in the New York Times the other day, Dr. Bernstein from Harvard, there was a little article in there, and he was talking about the type 1 diabetic, and they acted like this was new news. It's just old as the hills. But before we had insulin, 1920s, before Banting and Best discovered, how did they treat the diabetics to don't stay alive? It was a high-fat diet. And then as soon as they developed insulin, they told people, eat anything you want to, just increase the insulin. And people were getting disease all over the place. And Dr. Bernstein had been an engineer, not a doctor. And he was getting all these complications. He figured out himself, and he started checking his blood sugar much more frequently. So he had a very even blood sugar, finger sticks. And he helped develop the technology, actually. And he couldn't convince anybody of it. He tried published papers, couldn't get them published. Oh yeah, I was just reading the summary in his book. He has a book, and that's old as the hills. And then his complications went away. It took like 20, 30 years before people woke up at Harvard. At Harvard, they would. This happened at Harvard.
Yes.
With, with the Joslin Clinic and all that. But people were getting sicker. They weren't getting better, although they had insulin. It saved some lives, but they were dying young, 40s and 50s, from the complications of they had recommended a high sugar diet. Yeah, versus it's a very interesting story. So what do you tell the overweight type 2 diabetic? What do you tell them to eat?
Okay. The primary goal, I call diabetic people are carbohydrate sensitive. Means they just can't handle too much carbohydrate. So if a patient comes and they have gluten sensitivity, what do we tell them? Don't eat gluten. A patient comes and says, I can't take lactose. What is the treatment? Don't eat lactose. Diabetes is the problem with sugar, carbohydrate.
Remember, sugar is the booger and the hooker. I teach that to college students. That's what they remembered.
So first step to tell them that this is a carbohydrate sensitivity. You can handle carbohydrate. So first step would be make them learn which food has how much carb. So I'm going to give you a 3-page sheet. It has all which food has how much carb. I'm going to train them to learn it. And that they have to learn it. I'm going to tell them that if you're eating a food, if you don't know how much carb it has, please don't eat. I'm giving you information. You eat whatever you want, but you got to know how much carb you have.
The carb content of the food you're about to eat. There are tables on that. If it's white bread, it's probably...
So 1 piece of bread, 15 grams. So I tell them, you eat bread every day. So if you memorize that, how many times you have to look this up? Right? You remember this. So if you do 2 weeks, you will have good idea that which food has how much carbohydrate. Dr. Kachmann, it's so sad. These people may have 20 years of diabetes. They are on insulin. They are on a lot of pill. Invariably will find out they have no idea which food has how much carb. Which is very basic. So once they learn that, then I'm going to say, well, you got to do a low carbohydrate diet. So you try that. American Diabetic Association says low carbohydrate is 130 grams of carbohydrate. So if they say, I want to do that, fine. But we don't give too much information. You don't have to count net carb. You don't have to count sugar. Just focus on total carb. Give little information and say focus on that one and come back. And gradually they just become really optimal. Some patient will come, Dr. Ahmed, the sugar-free gum has 2 grams of carbohydrate. They teach me. I learn from them.
I think that's a wonderful. I think it's a wonderful way to look at it. I think that's just fantastic. We want to keep this simple. And I think you and I both believe that you can prevent and get rid of type 2 diabetes. Very simple matter.
Yes.
You know, keep a reasonable weight, learn to identify what carbohydrates are. Remember, Mark Hyman published a book called Eat Fat and Be Thin. So we agree with that.
Exactly.
And he's a good books to read, incidentally, as well as Dr. Furman. I wrote a book, Secret of Reversing Type 2 Diabetes. That's worth reading on Amazon books. And I have some other books on it. Matter of fact, I'll tell you the name of one. I don't have it here. So I called it The Fraud of Type 2 Diabetes. I called it a fraud.
Fraud.
Well, when you agree on it's a fraud.
Yes.
That we let people have it, that we don't teach them how to get rid of it at the family doctor level, the pediatrician level. Prevention, prevention, prevention. That we don't do that, to me, is a scam and a fraud. That's the name of the book. A little brutal, but let's face it, that's what's occurring, because it has so many illnesses attached to it. And then some people who don't like to read, for example, Dr. Joel Furman is a friend of mine, and I tell you this, and he'll be in town, incidentally, at the First Assembly Church in September. You want to personally meet him? I'll introduce you. I'm going to play him in tennis again. Last time I played him, I beat him in tennis, and he's a great athlete, so I was kind of proud of that. And he said he wouldn't come to Fort Wayne, unless he stayed in my house. He said that. So, yeah. So we, I run a pretty good refrigerator, but a couple of days before he comes, we're going to have a special inspection because he's written many books. But if you get his cookbook, is what I showed you, called Eat to Live, Quick and Easy. If you cook, it has smoothies in there. I like to recommend to people to get a Vitamix machine or a Ninja machine, which is cheaper, and have a smoothie every day. It's kale, nutrient density. Furman uses Andy scores. He gives kale 1,000 points. White bread would get 10 points. And and some spinach and some nuts in there, and curcumin or whatever you want to add to it. Maybe some protein. You can get protein in packages without having to eat meat. Vegetable proteins. It's called Live, L-I-V, and add to it, and you can get recipes on that. Incidentally, Kachmann, Facebook, Live to Be 100. I post a smoothie recipe on there every week. If you do that, you'll meet your nutrient needs of vitamins, minerals, and phytochemicals, and you won't be very hungry, and you'll be very healthy. To make it easy, again, we're trying to make it
simpler,
easy. And if you eat this way, probably lose a pound a week. But this, you can open Furman's book to any page, just open it up, and invariably it's a healthy recipe. Here's one, ultimate veggie dressings. He has dressings in there, and smoothies, and soups. Quick and easy artichoke and tomato sauce dinner. It's Michael Greger. Michael Greger also has a book like that, great to read, and he'll send you an email every day. He reviews the world literature. Are you familiar with Michael Greger?
Not really.
Yeah, he is part of Neil Bernard and the Physicians Committee in Washington, D.C., and I met Michael, and he sends you an email every day.
Wow.
On the latest in the world nutrition literature. That's worth looking at. He wrote a book, How Not to Die, but then he has a cookbook by the same name, and he also has excellent recipes. If a person would want to read anything and just cook that way, now I recommend people to learn to cook. If you're going to be healthy, you got to learn to cook. Mark Hyman, who wrote Blood Sugar Solutions, Eat Fat and Be Thin, his family will not, and he's a cardiologist, will not start the evening dinner till he's home. He has to help cook. So to which I'm learning. You cook?
Sometimes.
Sometimes, okay. But that way you look at the food, you know what I mean? And I remember my house burned down years ago when I was living in this very nice person's house. And he cooks, so he's trying to show me how to cook. He owned all the Pizza Huts, and he watched me do it one day. And remember, I'm a surgeon, neurosurgeon. He said, "No, Rudy, you're going to learn to cook." He didn't want me to cut my finger off. But I think that's a big one. You can't eat out twice a day and be healthy. I know so many people who own big factories and they're very rich, multimillionaires, maybe hundreds of million dollars. But when you use your eyes and you look at them, you know they're not healthy. And what good's the money? You know what I mean? You got to participate in your health care and learn to cook. So in summary, let's review this a little bit here in a minute's time. Your ambition, what you would like to do besides working at the Cooper Farms in Ohio, we get 2,000 employees. Can you imagine how lucky those employees are? You're teaching them how to be healthy. You're in essence their only doctor. And I know you've been cutting the healthcare costs in that factory tremendously. Incidentally, if you have a factory and you're watching this, call us because we could come over and teach you how to save a lot of money because we would work on getting, it's not just to the ill, we'll teach the patients how to get well. And that's a wonderful thing. So if a person, exercises, walks a half hour a day, eats a nutrient-dense diet, has a smoothie every day, weighs themselves every day, we can prevent maybe 70 illnesses, get you to live another 25 years, disability-free life because there's a lot of illnesses attached to diabetes. And look at my Facebook page, Facebook, Kachmann, Live to be 100, Kachmann, Mind Body Institute, that's another website. I put posts on there 10 minutes every week on maybe about gluten, maybe about any subject, proper blood testing every week. And Ahmed and I do see patients at the Three Rivers Pharmacy for free with these illnesses because we're passionate about this. We love you. We care about you. And that's the reason we're doing it. And if you get a feeling that we're passionate about this, you're right. You're right. Thanks again for coming.
Thank you.
And namaste. Have a great day. It's a beautiful day today. Maybe take a walk in nature like I'm going to do. And thanks so much.